Thanks for tuning in to Vitality and Motion. Let this be a place to grow your mindset and prioritize movement. All audio is original with music and production support from Riverside as my editing platform. This podcast is for education and inspiration only, and any studies or products I mention are simply for context. Take what fits in your life and check in with your healthcare medical providers as you feel is necessary. Hello, everybody. Welcome back to another episode of Vitality in Motion. Thank you so much for being here. I'm your host, Madi. Today, we're going to talk about something, unfortunately, I think a lot of us can relate to, and that is being in pain. And pain is literally everywhere. We can't hide from it, whether that's more of an acute issue that's been going on for about a day or two, or more of a chronic issue that's been going on for weeks, months, even years, or you might not even remember the last time you were pain-free. And this topic actually has so many layers to it, I didn't even realize. So actually, shout out to Dr. D. She's one of my professors at school. She did a lecture on pain and pain neuroscience, and I thought it was really interesting. And she actually follows this PT. His name is Dr. Adrian Lowe, and he, I think, treats in South Africa, which is pretty cool. And so he has his PhD in pain neuroscience. So I looked him up after class and I watched one of his lectures on MedBridge, which is basically a continuing education site for PTs and PTAs. And I was like, whoa, this information is wild. I need to share it on the pod. So here we are. And I feel like, especially as someone in the medical field, it's so important for us to talk to our patients about pain, because then it's going to make those unknowns more known. It can help to ease your mind, especially when you do understand it more. The good news is, overall, our body is great at healing, whether that's muscle, tendons, and ligaments. Now, the healing time will vary. A muscle does heal quicker than, let's say, a ligament because there's more blood flow to it. But there's also different factors that could affect that, whether that's maybe some comorbidities, like if you have diabetes or you have a history of smoking. But for the most part, our body is great at healing. The main question is, after we quote-unquote heal, why does our pain persist? A lot of this information I'm going to share today is from that lecture I watched with Dr. Adrian Lowe. So let's first start by defining the different types of pain we experience. The first one is called nociceptive pain. And this is where our bodies tell us that something is injured. It's the most common type. It could be from a muscle strain, an ankle sprain, or post-injury. It's your body's alarm system going off because it's telling you that there's something wrong. And it could be sharp, stinging, dull ache, or throbbing. Most of the time it's temporary, and it will pass and our bodies will regulate and the pain will go away and the tissues are healed. So that one's pretty straightforward. The next kind of pain is called neuropathic pain, and this pain usually comes from more of a nerve dysfunction or injury, and it may feel like a burning, tingling, shooting, numbness kind of pain. You kind of want to think of it like a frayed electrical wire sending a bad signal. The third type of pain is called nociplastic pain. And this one is a little more misunderstood. There's usually no clear injury or tissue damage, but for some reason the nervous system and the brain are like overly sensitive to pain. The pain may feel real, and it is real, but the volume is turned way up. And it may often vary from day to day. It may be related to something like fibromyalgia or chronic low back pain or even headaches. So to kind of summarize all of that, nociceptive pain is usually more of an acute injury in its injured tissues that will reduce over time once the inflammation has cleared out. Neuropathic pain, we want to calm down or protect the nerves. Nociplastic pain, we may need to help to retrain the nervous system, help with stress regulation, and encourage movement, sleep. This could also be psychologically related as well. This is where a PT or any medical provider could come in and recognize what kind of pain you have and treat you based off of that. All three of these types are drastically different. If the patient understands that from the get-go, then it's going to shift their mindset as well. So just something to consider whether you're a treating clinician or a patient. Most of the time we don't know why, but the body can continue to experience pain without any kind of input or injury, even once the tissues are healed. Pain doesn't always mean damage. Sometimes it just means sensitive nerves or overprotective nervous system. Ultimately, it's influenced by our brain. Adrian Lowe actually gives a pretty good example in his lecture, and he says, if you were to walk off a curb, roll your ankle, and sprain it, would it hurt? More than likely, yes. But if there was a bus coming and you're about to get run over, would it still hurt? The answer is probably no, because the brain is making a decision of, my ankle's in pain or do I need to save my life? And more than likely your brain is gonna save your life. There was another study that he mentions about a construction worker who steps on a nail at work and it goes through his boot. He's in so much pain, the doctor gave him all the best drugs, and basically when it came time to cut his boot off, they found the nail in between the two toes. It had actually not penetrated the foot at all. So this again just shows how much the brain can play a role in our pain. Anytime our brain starts to question its own map or pathways, that level of stress or level of threat goes up, producing the pain. So bottom line is our brain is always playing tricks on us, and so we almost have to like check it or question it and be like, is this really how I feel? Am I really in pain right now? Or is it all in my head? You know, it's kind of crazy that's the way it works. And I just want to clarify that I'm not trying to dismiss anybody's pain, because pain is real. We all experience pain. But what I'm saying is it's okay to question your brain and be like, why am I still experiencing this pain? And what can I do to help this further besides what I'm already doing? If you feel like you're kind of in that band-aid fix of you're taking Advil every day, you're using the hot pack every night, go seek help and find someone who's an expert in this or that can help guide you in the best way possible so you can get out of that negative feedback loop. Pain is also influenced by our environment as well. So be curious with this and don't just feel like, okay, I've been having pain for years, it's not ever going to go away, because that might not be true. All right, and lastly, I just want to leave you with some main points to consider here. As we know, pain is influenced by stress, poor sleep, anxiety, past injuries, and simply your belief about pain. Pain pathways can become stronger, but they can also become untrained or retrained. And so that's why actually pain education alone can help to reduce the pain. And I'm a huge advocate for sleep routines, maximizing your sleep. So definitely check out my episode about sleep and HRV. That's got a lot of good info in it. My next thought is avoiding movement can actually make pain over time worse. And I think that's a major limiting factor for people, is a fear of things getting worse. But it's proven that motion will decrease pain, even if it's gentle. And again, maybe that's where PT comes in and kind of helps gradually get you back to, you know, what you were doing before and confidence with movement. And gentle, consistent movement can make a huge impact on helping to calm the nervous system. The goal, though, is confidence and not pushing through the pain. So there's a difference. And the body is capable of amazing things and can learn to safely move through movement again. And that kind of leads into my next point of reframing the meaning of pain to you. Instead of, I'm going to make things worse or damage things, maybe you say, this is my nervous system being overprotective. And you can actually regulate your pain by 360 breath work, deep breaths, spending time outdoors, meditation, social interactions. Pain will improve when we feel safe. And if we're constantly in a fight or flight state, our body is going to be in a constant protective, tensed mode. And lastly, get support regarding your pain. Don't just get an MRI or a body scan and realize, wow, I have 2 slip discs, my life is over. No, educate yourself about your pain, whether that's listening to something like this podcast or attending PT or even, maybe seeking mental health support like counseling. Find the help and support that you need to get back to your life and to stop avoiding the fear of having intense pain, because pain is not a forever thing. And don't let your brain trick you into thinking it is. Hopefully that all made sense, and I will see you all next time. Thanks again so much for being here. If you're looking to connect with me on socials, my Instagram is vitalityandmotion_. My YouTube is at vitalityandmotion with 2 N's at the end. And then my email is vitalityandmotion@gmail.com.